well as with what we have now dubbed our Return to Learning Task Force, or Return to Building Task Force. Appreciate that the team has pulled together information, some things that we've seen before and some things that we have discussed, but this is a pretty comprehensive accumulation of all those pieces. So I think I'm going to start off with turning this over to Roxana. As the board communicated to community back in September, there was a number of items that we wanted to review before making any determination on returning to buildings, and this is a compilation of those items. Primarily, the thing to dig into tonight is a number of the data points that, while we said that we're going to look at a number of data points, there are sometimes an overwhelming amount of data points to look at, and so I know that Roxana and the team have prepared some very specific looks at their rationale for the conversations and the recommendations that they've been making. So with that, I will let you walk us through it.
Great. So I do want to say to the board that this is an attempt to pull together, certainly not an exhausting list of data. We really focused on the data that was recommended by the CDC for schools, and also the data that came out from the joint task force, if you will, between DESE and the Department of Health and Human Services. And so I have chosen to start there, but my training as a social scientist tells me that there are multiple ways to look at any complex problem. So I do want to acknowledge to you and anybody listening at home, we are very much aware that we could look at data through a public health lens, we could look at it through a community concern lens, we could look at it through an economic lens. The focus tonight really is on that very narrow educational lens, and I'm offering that as a starting point because if you as board members would like to bring any of those additional pieces into the conversation, while I don't have them in the slide set, I can talk to you a little bit about what they're showing right now, because some of those pieces might be of some concern to you because we do operate in a community context. So I just want to acknowledge that as we start talking, but I'm going to walk you through these data pieces. Also, as a data nerd that you know that I am, I want to contextualize this data and let you know that this data came very specifically from 3 sources. It came from the CSD release dated October 15th. It came from the county website, which was accessed on October 20th, and it came from the state DESE website accessed on October 20th. And I say that deliberately because if you go to those sites at this moment in time, they may or may not be the data that's reflected in the slides. And I'm going to talk to you a little bit about some upward trends that we're seeing in certain areas and why that might be, but I'm going to, rather than continuing to change the data, I am leaving the data intact as it was at that moment in time. Okay? So when we look at data, when we contextualize the data, we have big numbers. So these are the numbers that you're probably used to seeing in the Post-Dispatch. These are the numbers that you're probably used to seeing, the statewide data of total number of cases since this pandemic started for the state and then for the St. Louis region. And so those numbers are important to us because they tell a story about the context for us, both within our state and how the state is thinking about it, and also for the city. So you can see that as of that date and time, there were 11,000 new cases in the past 7 days in the state, and 1,400 of those were in St. Louis County. You can see that there were 10 deaths in St. Louis County. So those numbers are important, but those are not necessarily the numbers that we have been recommended to pay attention to as a school district. And so for those, we're going to go to 3 specific sets of numbers. So the first number that we're going to look at is the transmission rate. And, Chris and I joke. I talk about scientific data the way I talk about tech sometimes. I understand how it works. I don't always immediately have the right word. So I'm going to talk in very layman's terms. If you are a scientist or a healthcare professional, I apologize to you if you're listening to me right now. But the transmission rate in its most basic form is a rate that we want to pay attention to because this tells us a little bit about the spread. Ideally, if we have a transmission rate of 1, that means one person would give it to one person, and so your rates are staying fairly constant. We want that number below 1 because anything below 1 means that the rates are declining. And so again, if you look at the state of Missouri, we are at a 1.08. If you look at the county, we are at a 1.03. So we are still not reaching that number of 1 that we would really like to see. And there were no local transmission rates available at the time that I pulled this data. Okay? Does anybody have any questions about the transmission rate? All right. So this next chart is a chart that I refer to frequently. So this is the CDC chart that tells us kind of what we're looking at and what is the range in which schools can be operational. And so if you want to think about our tiers of operation, tier 3, the highest risk, I don't think we can actually put them in terms of our tiers, but they would say, like, you definitely need to be all virtual in that highest rate, anything above 10, right? Because that's a really high threshold of positivity rate, okay? So we'll look through that. I'll refer to that as we go so you can kind of see where we are. But we're going to be looking at the number of new cases per 100,000, and we're going to be looking at the positivity rate. And then the third thing that's at the bottom of that table is, do you have all of your layers of protection fully functioning, right? And so when we talk about contextual data, we want to make sure, ideally, our numbers would be on the low end and all the layers of protection would be operating. But one of the things that we're hearing from the epidemiologists are, if we've got all of the layers of protection operating and firing in all cylinders, we can actually be in those higher thresholds of numbers and still operate safely. So we're constantly watching kind of what the balance is between all of those factors. All right, so if we look at the 7-day new cases per 100,000, you will see that for St. Louis County, it is at 19.8, which is below. I'm going to back up here for a minute. That would put us in this green band here. It would put us below the 20. And if we look at the central corridor, which is where Maplewood, Richmond Heights is located, it's at 13.7, so it's lower than that. And it's been fairly stable in the central corridor throughout this period of time. And so that's a number that we are looking at and watching. I will tell you that when I just dipped in to look at the numbers today a little bit, that number of new cases has increased slightly, so I would expect that that number, at least for the county, might go up just a bit in the next time that we look at the numbers, okay? The other thing that we look at is the positivity rate. And so the positivity rate is, how many of the people that were tested, what % of them tested positive. I guess that's the easiest way to say that. Ideally, we would want that positivity rate to be less than 5. Less than 10 is operationally still within range. At the state of Missouri, at the time I pulled this, the positivity rate was over 21% for the state, which is incredibly high. For St. Louis County, they were reporting a rate of 7.7, and for the central corridor where we reside, it is at a 2.3, which is fairly low. And that's actually a function also, I think, of the fact that the central corridor has consistently had the highest rates of testing, okay? I can also tell you that the state issued, I don't know if it was yesterday or today, a second kind of number. They're also now charting how many, they're doing the number based on all the tests, and then they're doing a number based on, like if some person got tested 3 times and then ended up being positive on the 3rd test, they're counting that as 1 so that the positivity rate is not artificially low. Okay? I hope I said that in a way that made sense. All right, this is the COVID data based on rate per 100,000 specific to age groups. And so you can see that there's a fairly low rate for students or children from 0 to 14, and you see that 15 to 19 rate went up, and it's been slowly coming back down as well. This particular week of data, the one that actually increased this week was for students in the 5 to 9 year old range. They did issue a caveat that they believe that part of the reason the rate went up is because the number of tests is very low. Folks usually only take a child of that age to be tested if they're pretty sure that they have COVID.
That's
Okay.
actually what I was just about to ask you about. It was my understanding that there was not a lot of testing amongst that age group, unless there was
Correct.
already a suspicion of it. And if parents were testing positive, they were saying just assume the child has it, quarantine, and they still weren't testing. I want to know if you had heard that, but you've answered my question.
Thank
so
you.
Go ahead.
Thank you. All right, this next one is cases per 100,000, and this is new cases. And so these numbers, again, I want you to look at the scale here because the scale is actually quite low. So the numbers may look higher, but this chart only goes to 20. So you can see kind of what I was talking about. You see those 5 to 9 year olds that kind of spiked up there. And you can see a little bit of a spike also for the 15 to 19 year olds, whereas 4 and under is fairly level. And it's not quite as steep for the 10 to 14 year olds. So we're kind of watching, even though those rates look low, we're trying to figure out what's going on in those rates. I did have the opportunity, I think this would be a good time to say, I did have the opportunity to sit on 2 webinars this week with people from the health department and some epidemiologists, and one of the questions we asked specifically was, now that more kids are back in school, is this a direct translation in terms of, students actually contracting COVID at school? The answer that I got from 3 separate people that we talked to was that while transmission in school is possible, they're really seeing the transmission happen at after-school events, sleepovers, and on the weekend. So they're seeing very little let me be clear. There's a lot of quarantining happening in schools that are open, because if somebody comes to school and has COVID, we may have to send folks home to wait, but they're not actually seeing transmission in those cases. The transmission as they contact trace seems to be coming from things that are happening at home in more relaxed environments, when kids are eating together, playing sports together, or running around without masks in that manner. So that's something we want to continue to watch, because we know that as folks are going back to school and as flu season, all of these things are happening, we expect these numbers to move, but those are some of the things that we're looking at and some of the questions that we're asking. So what's actually happening with us? I thought that this is something that you would want to see and see regularly. The county does not report, and we should not report any number less than 10, because it becomes very easy to identify individual students or individuals' families. So know that if the number is less than 10, you're always going to see 1 to 10, which is why that has asterisks. So our total number over the entire COVID closure has been 25 student cases within the MRH school district boundaries. Now that would include any private school students, any homeschool students. So just because there are 25 cases in our boundaries does not mean they're all MRH students, but we would have no way of knowing that. And you can see how that has played out, so that we know we have somewhere between 1 and 10 students in each of the age bands that we would be affected by. And we do have at least 1 case in 10 to 14 year olds in the last 7 days, or 14 days, excuse me. Okay, and then staff cases. We have had 4 staff members in the last 7 months who have had COVID. We know based on contact tracing that none of those were a result of exposure or transmission at MRH. And we've had more staff members than that quarantined because of exposure to these people before they realized they had symptoms. But that is what that looks like. Okay, currently, we have 2 staff members who are in quarantine, again, due to exposure that did not happen on our campuses, but are being asked to stay home until it's safe for them to return. And that is my data report. I'm happy to answer any questions you might have about the data.
Thank you, Roxana. This is very helpful.
I agree. It's a really comprehensive and well-done report. Thank you.
You're welcome.
Yeah. As far as, I mean, to your opening statements about, these are the data points that have been recommended to school districts to look at for whatever reasons they are the ones, and not, others. Can you talk about why the positivity rate is one that's been recommended for schools to look at? Do you know the reasoning behind that particular one? It tends to be one that I think has a lot of problems because of the lack of, the inconsistent, access to testing. I can see how maybe in other communities or even other countries that makes a lot of sense, but it is one that is doesn't resonate, I think, as well for me. But I recognize that it is one that has been recommended for us to look at, and I'm just curious as to why.
Without stepping into a field that I don't practice, I think the easiest way to say that to you is they keep talking about contextual data. In my assessment world, we talk about triangulating data. So it's not one that we would want to look at by itself, but it does tell us something in comparison to the other data points. Because we know how many tests were given, because we know how many people that took those tests end up positive, and because we have this other data, we get some sense of, I think, community spread and community access to testing. And so we could pull out how many, I do know, I could tell you how many people got tested and how many people that got tested were positive, but that all just gets condensed into a positivity rate that helps us have a single number that's a little easier to manage to compare to the other data. So that is kind of the best answer I could give. I also promised you some contextual data that wasn't part of this conversation, so I can tell you right now that the doctors that are reporting are telling us that the daily diagnosis among all people, not just school-age people, is high right now. I can also tell you that hospitalizations have increased, so I think the numbers I saw today, if I remember correctly, were around 25%. So there are, hospitalizations are up. However, death rates have decreased substantially, and they believe that's because of better treatment option. Testing has increased dramatically, so they're running at about 186% what they would like to see. So there has been a lot of testing, at least in our area, and they're pleased with that. The largest increase has been between, in positivity rates, has been between people of 40 and 79 years of age. And I already talked to you about that increase with the 9 and under, and what that meant. Specific to our zip code, so I am now able to get some zip code data, which I told you in a prior meeting we've been asking for. There were 23 cases, new cases, in the last 14 days in the Maplewood area, which means that our rate is about 3%. In the Maplewood zip code. There were 9 cases in the last 14 days in the Richmond Heights zip code, and that would make their percentage less than 1%. Okay, so that if that gives you any contextual data beyond what I've shown you, that's kind of the lay of the land locally.
Roxana, can you help me understand the significance in looking at like the Central Corridor or just Maplewood, Richmond Heights zip codes? And I guess what I want to really understand is, like, I look at it as a regional, so the county, and I understand that we can get numbers regarding the corridor or our zip codes. However, we have staff that doesn't live in Maplewood, Richmond Heights. They're in other areas, and so it just seems to me that to focus just on like our zip codes or the Central Corridor is narrow. And so can you help me understand why, educators are looking at like certain zip codes or areas? And
I would
and not
give you-
just the county?
I would give you almost the same answer that I give Katie, right? If you're looking at data, you have to triangulate that data. You have to have markers so you can contextualize what you're seeing. So yes, we have folks that live everywhere, and the regional data is super important. But when I look at the central corridor, I look at our zip codes, those numbers have been very consistent for 7 months. So that means something. I wouldn't say I know exactly what it means, but it does mean that folks in our area are doing something differently than the county at large, and that will have some bearing in terms of how our families and our students respond to instruction in our schools, right? So I wouldn't just look at that and say, oh, it's okay because the central corridor's good. I would also take the county data into contextualization, but I think it's also a very important contextual marker that says, okay, whatever it is about this group is whatever they're doing is having an impact that is clearly different than the rest of the county, and that works in our favor as we think about a return to school.
Okay, thank you.
I do have a quick question. Are you seeing a trend, though, of as the rates are rising in Missouri, they're rising in the county, and then also still, I know that we're consistent, but it sounds like we are still rising. Is that what's happening?
I don't know if I can give you a blanket answer to that. I would say that the county numbers actually were stable and decreasing for a while the state numbers were rising. I would say that we've had a slight increase in the last 14-day period, whereas the state has had a significant increase in the last 14-day period. So when we look at the trends, that's part of the reason they tell us to contextualize the data, because we're going to see all of these numbers ebb and flow and rise and fall. And so we're trying to make sure that we look at all of them in context with each other to give us signals about, what that looks like for return.
I think the mask mandate in the county has been extremely helpful because the county rates have not risen as much as the rural rates where there hasn't been a mask mandate.
Right.
And then the point of central corridor testing being consistently high across all time periods. I actually think that does matter to us because I think when and if, we have in-person learning, in addition to all this data and all the supports and all the safety recommendations, we do need to also continue to talk to our community about safe practices outside of the school and at home. And so for me, central corridor data like that is a critical piece of it, not the only piece. And as you just stated, I think something that's important. Just to see the testing and how the normalization of safety measures are, how is our community responding to that?
I think that's super important against what I said about what they are telling us from communities that are back in school and where the transmission is actually happening. Those numbers we need to watch because if everybody's doing their part in the spaces that are away from school, then the safer it is within school, obviously. And less quarantining that would have to happen because we'd have less risk of exposure to positive cases.
So just also, when we're thinking about the county numbers and we're thinking about hospitalization rate too, I know that's not something we've honed in on. Let's also remember that our friends out state don't have access to the care, the quality care that we do here, especially in the central corridor with so many hospitals close by. So a lot of those numbers are individuals that are not from our, sadly, that are not from our region that need our services. So I just want to put that out there. Nikki, I hear what you say too about looking at the whole county, and I'm really mindful of that, and I pay very close attention to that, most especially through my profession, but I also do believe there's great value in looking at that number of 63143 and 63117 because the majority of our constituents are our kiddos, right? That's where they're living. So it's kind of, I think, Roxana, you brought up a really good point about what are we doing right here? And then how we can convey that to our staff that might not be within these two zip codes to be better in their own communities, to model that.
Yeah, and to ease anxieties as well, right?
Exactly.
Those staff members have to be confident that our kids and our families are going to continue to stay vigilant, right?
Right, absolutely.
Yeah.
I was wondering, about the use of the Ed Plus data. Have we decided that we're not going to be, because I don't think I'm not certain that you referenced that in your presentation.
Yes, so these numbers came from 3 sources. The Ed Plus data that came out on, it was the days through October 15th. We
Okay.
received it on Monday. The state data, which is DESE and the Department of Health, and also the county health data for the same 14-day period.
Okay, so just one question then on the Ed Plus data, since it was referenced. Sorry I didn't notice that. On the last set of data here, we have 5 consecutive 2-week periods of increased spread in our county. Now, this isn't zip code data, I admit that, but
Which page are you on?
I'm sorry, I'm on the Ed Plus data that was in the,
Which page are you on?
it's page 13 of the Ed Plus data.
Thank you, thank you.
I think you're looking at the St. Louis County data.
I
now.
am, now that I just realized that, thank you.
That's
Let me
okay.
Let me find the right thing.
And just for the record, I think you referred to it as CSD data.
Yeah.
which
I
is
did,
sort of
I'm
the old
sorry.
name for Ed Plus.
I went
So
back
you
10
were-
years.
We didn't hear Ed Plus. I just,
Yeah, because I wrote it down, I'm like.
I know.
Did we
Language is
miss it?
important and it can easily trip us up, and
It
I
is
just want to make sure that.
Education Plus, it used to be CSD and I'm
Yeah.
old, so that's why. They're rebranding
I
10
didn't know
years
that.
ago, still hasn't stopped.
CSD has a better ring to it.
Yeah.
That's true.
Agreed.
I like, well, I keep thinking Ed. I'm like, is this Ed's data?
So this is, okay,
So in St. Louis County, we've had what looks like 5 consecutive 2-week periods of double-digit increases in case numbers. Now, I realize that the red is simply because it represents 10% of the previous period, which kind of makes it look more alarming maybe than it really is. But I'm just curious, since these are 14-day periods, they predict a longer-term trend, potentially. Are we working that into our data analysis?
yes, and if you look at that, they're different by 1 day each time.
Right.
So it's still a 14-day period, but it's a daily increase. If you look at the metrics there, so it's 10-5 to 10-11, and then they do that, and the next one starts 10-6 to 10-12. So that's daily data that we're looking at. We've had an increase in the 14-day periods for each day for the last 5 days, if you want to think of it that way.
Thank you for that clarification.
You're very welcome.
And just to be clear, I'm just double checking, that's for all age categories, Roxana?
This is, yes,
Okay.
yes. And again, if there are any of these pieces that you feel are really important to the group, we can certainly add those into what we're looking at. I just started with the CDC recommendations and the data that we most frequently look at in educational settings, but we can always add additional metrics if that's important to you.
While this one's just iterated on a daily basis, as you just mentioned, it does compare 2 periods
Yes, it
in a
does.
longer-term time frame.
It
So I
does.
think it kind of smooths out the herks and jerks in the data. So I personally think it's worthwhile tracking.
I agree.
Just to be clear, though, it sounds like you are tracking it and looking at this data in conjunction with the other data
Correct.
that you're tracking, just to be
Correct.
clear.
It just
It's
doesn't
actually being-
present well on a dashboard, if that makes any sense at all.
Okay.
It presents well here, but to try to put that in a dashboard flow is a little trickier, but it is something we look at, if that answers your question.
Okay, yeah.
Again, I know, especially with the color coding, this Ed Plus data just, is difficult to make sense of without the conversation about it, right? It was a broad pull for a broad constituent base as opposed to, you know, targeted for our specific district. So I, yeah, appreciate the questions and the context as well. All right, other questions, comments about the data that we have access to? Again, we did not, in our message, indicate those specific data points, because I think we, as the board, know that we had experts who could tell us what the data points specifically should be, but that we know that we're actually looking at health department, state, and DESE department data, as well as the polls from Ed Plus. If that's sufficient, then we can move on to some of the other points that we.
I guess I just had a question, and maybe it's covered in some other points in the agenda, and I can totally wait if that's the case. But how do we communicate, assuming the board is comfortable with this multi-data approach from these different sources? How do we take, you know, this myriad of attachments here and, you know, communicate that back to the community? I think we did something like you referenced earlier, Katie, in September, but I think it would be worthwhile to have a communication piece that references all of this in a clear manner. So maybe we're going to talk about that at some point.
I think that's a good point, and my question also would be, because we can certainly
Excuse me
make
one
room.
second. Roxana, can you talk up just a little bit
Yes,
more? Thanks.
I said I think that's a good point, and we can make room for making this public, and we can also update these, if you like this format, and if we land on the things that you want for your dashboard, that's certainly something that could be updated and put on the district website, and then certainly reiterated to the board at whatever interval you would find appropriate. I would not recommend doing it more than once a week, simply because the data, when it gets really difficult, and my greatest fear and my hesitation in doing this initially was we didn't have the right data. Now we have the right data. But the data on all of the sites I mentioned change at different times and at different intervals. So I want to be sure and very clear about where that data came from and on what date it came from, so that folks don't go to those sites and then somehow think that they're seeing something different than we've shown in our dashboard. So I think it would be important for you to figure out where do you want that public facing, and how frequently would you like the data updated.
Yeah, I mean, and I think that's a good point, and I hope that's part of what we can dig into in the next agenda item, but thank you for raising it and calling it out again. Great. So the next item that we had discussed was input from the folks who actually work in our buildings, whether it's administrators and staff. Obviously, we had some questions last week about you know, communications that the board had been forwarded by some teachers, both in support of being virtual and in support of returning to classrooms. So you know, in some conversations that Roxana and I have had this week, the acknowledgement that, you know, Roxana certainly doesn't speak for all 200 plus educators in the building or in the buildings, but can report back to us from some of the folks that, you know, that she has talked to or heard from. So I don't know if there's any additional context or additional questions that folks might have, but again, just want to acknowledge that I don't think any of us believe that all of our staff have the same opinion about anything, much less you know, COVID. So, you know, wanting to acknowledge that and acknowledge that we do have some mechanisms for hearing from our staff and from other, you know, constituent groups within the employees of the district, and just, I'll turn that back over.
Yeah, so Vince and Chris and I met with the teacher leaders on Wednesday. We had a really healthy conversation about their concerns and what they are hearing. So both teacher groups have collected some information and are willing to share that. What I heard loud and clear is that they would like to see improved communication loops. They know there are venues and they know there are forums where things are happening, but it's hard in COVID because it's Zoom. So where they were able to talk with each other in the halls or catch up and get information, that's not being able to happen, and sadly we have not figured out yet how to fill that void. So we've talked about creating we've had for a long time a staff page in It's Learning, which they all use. So their suggestion to us was that we take the minutes and we take information that's important, like these data charts, and make sure that it all goes in that site that they all can access, so that they have the information at least there in a written form, and we thought that was an excellent idea. The other thing that I heard loud and clear is they like staff surveys so that they can be sure that they've had some voice. And they suggested that the next staff survey should really be around the building plans so that we know who's been trained in the building plans and if they see holes or gaps or if there are particular pieces and so I would, like to do that with them in the coming weeks. And yeah, I thought it was a really productive conversation. I don't know if the two of you would like to add anything.
The other thing that they mentioned was moving forward is just to have a more clearly articulated kind of building reentry task force at every building that they could participate in and know who represents them. I think we've had iterations of that, but not consistently so. So I think they mentioned that thing, the survey, a place where they can consistently see updates on reentry plans and data, and also a kind of a task force that's working on that specific building.
I think that was important because they said they knew people were working. So I mentioned we had in virtual learning coaches, and they said, yeah, but we don't necessarily know who they are.
Right.
Could we, have lists of who these people are so we know who to go to, so that we know who we can ask questions of? Because, and I thought this was really important, they said, we don't want to just bother our administrators endlessly with questions. And right now it's email or Zoom and we know they're overwhelmed. So a lot of times we're not asking and then we don't know. So we can do better. We can do better, and I think those were really good suggestions and things that can be easily implemented.
And just wanted to also mention that at the teacher leader meeting, which we have every month, it did include representatives from the group that had sent a letter to the board the previous week. So it was nice to be able to have them in the space and have a conversation. It's productive.
Thank you all for having that conversation.
Yeah.
Yeah, and I acknowledge that just the relationship between the district and the two unions really that we have here is not the same relationship that some other school districts have with their union too. So, again, just acknowledging that we've had a much more cohesive sort of approach to negotiations with teachers and things like that. So.
So Katie, I want to thank you for acknowledging that, because that I think has been a little bit of misconception, not only within staff but within public, that there is this contentious relationship, and there isn't. And many of us have worked very, very hard. Most everybody in this room has worked very, very hard. So thank you for acknowledging that and making that clear.
Yeah, I think that one of the, I think it was a surprise to most of us to get the letter out of the blue last week too, and the assumption that we do have these channels that are there. And I think, again, the challenge has been that Zoom and virtual building meetings and things like that just have not allowed for the pathways for those folks who've been in the union to know exactly where the right places to plug in are, or the existing places to plug in are. So I just like a parent who may come right to the central office with a challenge, as opposed to starting with their with their teacher and then their principal. I think it's it's just understanding the channels, right? So.
Can I ask one question here?
Sure.
I was going to ask you, with you meeting different guys, how do you feel like the comfort level maybe among the individuals that you talk to, or is there a lot of anxiety still among people, or?
I mean, staff?
Yeah. Or how would you put it generally, the feeling.
I wouldn't say there's a lot of anxiety. I would say there's some anxiety. I think there's some range. There's some staff that have been on campus pretty consistently. The more they're on campus, I think the more comfortable they feel in terms of some of the mitigating measures. Some folks have been at home more, so I think there's probably understandable levels of higher levels of anxiety there. People's personal lives are different in terms of who's at home, which really impacts their anxiety level. I think they're cautious, but they're really open-minded about the possibility. They just want to be part of the conversation, you know, and part of the planning. I think all the staff I've met have had, with very few exceptions, have been open about where we're going. They just want to be part of the journey and have a voice, I would say. The anxiety kind of waxes and wanes, but I see less in some ways since we've been open and people have been on campus a bit.
I feel like there's a positivity.
Yeah, you know, what's been nice is that we've kind of dipped our toe in having students on campus for interventions, and that's really opened up like, okay, this feels okay, you know. Had a kid that had a cough, sent him home, he didn't have COVID. It all feels kind of like we're practicing some protocols, a couple of bumps, but mostly pretty good. And so it's been nice actually to do that on campus because we've had a chance to practice some of our mitigating measures, protective measures, and also some of our protocols around, you know, kids that come home maybe sick and that kind of thing. So I think the more we get practice, I think people feel less anxious. Yeah, but some folks haven't been there as much, so I think there's some variance there.
Well, that's good to know.
Yeah.
I've shared.
Yeah.
Yeah, and I think the idea of a survey that would ask staff if they see gaps in the, you know, the performing of our mitigation measures, you know, I mean, I think that's wise to, you know, get folks to take ownership too of the safety precautions.
Yeah, we had sort of an interesting, kind of a light story, but a poignant story. We had an impromptu plexiglass trial run when they were putting in plexiglass at ECC and it was too short. And we had some staff there trying it out and sitting in the seats and putting stuffed animals in the seats. And we ended up making some adjustments. But the funny part was like they were able to participate in that because they know what kindergartners, how much space they occupy. And so it was really helpful because they were asking me to look at it. I'm like, hey, I don't teach kindergarten. So it was really nice. And I think the faculty felt empowered. But it's a great example about having them to be able to kind of survey their own teaching spaces. Those kind of things are really helpful. Yeah.
It's good to know.
Yeah.
Any other questions or points about staff sentiment? Great. Availability of personal protective equipment. I know that we have the clear budget, you know, items to know what we've spent specifically on COVID. I don't know that we need to go deeply into this unless there are questions from the board. I think this is something that we've had clear and consistent information about.
Yeah.
All right, great. Then we'll move on. Transportation plan. Again, I think that is something that we've seen a couple of iterations of. We know obviously we won't have the final look until we actually know when and what children we're bringing back. But is there anything to update or any questions there to ask about this?
We'll probably talk about it when we talk in interventions, but we have identified some students who are in critical need of intervention that are at risk because they do not have transportation. And so we will be doing, or plan on doing, some bus runs in the next week or two, specifically for those students who have no other way to come on campus. And so we can talk a little bit more about that when we talk about interventions and how interventions are going.
Great. Environmental safety review, and I know that we have received some updates from Mr. Whalen about ventilation and air circulation and things like that in the buildings. I don't believe there's any updates on that, so wanted to see if there were any other questions or concerns to point out around that.
I just have a question about just like the need or how helpful it is to have like outside air brought in through the ventilation system. And I'm just wondering, is there anything more that we can do with the systems that we have to make sure that that's happening, that we have more outside air coming in?
So I've talked to them about this multiple times, and I had the architects come also to give me their opinion, and they're telling me that the air in these buildings is much safer than the air in your house, that we do have an outside air return, and we meet those thresholds. Now, the one concern that I do have, and I did speak with both Melissa Foose and Erica Payton today, is that is not necessarily true for our SSC house. So we are in the process of purchasing for them window fan units that will help with the circulation in that space, since that is more of a residential construction. And so that was at the recommendation of our architects, and so we will follow those recommendations and make sure they have them as they're working with students in their space.
All right, thank you.
Yeah, so thank you on that, and I think that reaffirms the decision that we made about our alternative spaces coming back to here.
Yeah.
I mean, that's an equity piece for us, so thank you. And I want to compliment Mike. I think through this, he's been clear. I think he's been on top of it. I have great confidence in what he's presented.
Yeah.
I know he's not here this evening, but I just wanted to make sure that publicly I stated
Right.
that I compliment the work that he's done so far on this.
I agree.
Yep.
I agree with that.
I'd like to have an update on when some of those things take place, like changes that we are making into the buildings that we feel are necessary for the returns. Once those happen, I'd like to find out that they've happened. I mean, I don't care if it's the whatever meeting report or whatever, but just to know that those things have actually occurred.
So Brandy, are you stating like how Mike provides us those reports, you want that embedded within there? Because I know a
Yes.
lot of these things are in there, but if you want a specific call out, then I think you need to say that it specifically needs to be called out so you're recognizing it's in there.
So we just started with his reports not so long ago, and I think they've been very thorough. But we're just now also getting, hey, we've identified this particular thing as necessary for ventilation, for example. So because the reporting of that issue is new and his reports are new, I'm assuming that'll be in there, it'll be integrated, but I'm not sure. So that's why I'm just saying, let's if that wasn't the plan, can we add that to the plan? Though, like you said, he's been very thorough, so it probably is. But because this is just two new things that we're bringing together.
Do you want that at his regular report at the board meetings, or?
I think that's fine.
Okay. Great. Any other questions about the physical and structure piece there?
I do have a quick question that someone asked me, and I know that was presented in the last meeting, and Vince, you've mentioned it, but are the partition, I'm calling them the wrong thing, the plastic partitions?
Yeah.
And I know we saw adorable pictures of you at the table with it. Are those already in place, or have they been removed now that there's not an anticipation that we're going back right away?
No, they haven't been removed.
They're still there?
They're still there.
Okay, great.
And we use them, it's kind of nice. I mean, like some of the tables we have, we just have them popped up, so yeah, they're still there.
So, and they are throughout the building then, or just in certain spaces?
I wish Mike was here.
They're installing in stages.
Yeah.
So the first install was at the ECC and MRH.
Yeah.
But we are working on middle school, so they're not all here for the middle school. We focused primarily on intervention classrooms and in any space where, when we talk about interventions, there are some students that are here like from 10 to 2, and they eat on campus. So we've got some that look like the ones that are here behind me, for any space in which a student would eat, and there's usually 2 students, but that plexi, if they have their mask off and they're eating, does provide barrier protection when masks cannot be used. And so we are very strategic right now about where we have them, but we have walked with the architects every single space in the building, and they have, and I have samples of this, I didn't think to attach it, but we have classroom composition maps of where the architects have recommended the furniture goes.
Yeah.
And then in addition to that, how plexi is laid out on that furniture based on the learning that is going to happen in that space.
Great, thank you.
Any space that has plexi, it remains. In fact, that plexi up there was actually on these tables.
these
We just
tables,
moved them
yeah.
because of the meeting.
They had to move it.
They'd go back on the tables because we have students coming here for interventions, and so they're used for an additional layer of protection.
Thank you.
Yeah. And we get rid of the ones that were too small. You saw from the excellent photos.
It
Some
was
of them
adorable.
were-
So all these plexi petitions are more or less able to be moved at any time?
Well, some of them are, but they'll eventually, because they're kind of light, so they're going to, once we decide that that's the right size and that's the configuration room, they're going to put adhesive to attach them to the desk. Otherwise, the kids will be knocking them over all the time.
Yeah.
So we don't want them to be moved, Ralph, and one of the things that we're doing is in each space, we have very defined seating charts, and we
Yeah.
ideally want the students to sit in those seats each time, because if we have to do contact tracing,
Yeah.
or if we quarantine students, making sure that the same students are sitting in proximity is also a form of cohorting. So if you are in a classroom and there's only 15 kids in your classroom, let's say, and then you're only sitting 6 to 8 feet away from 4 of them, if we had to quarantine, only the 4 that were closest to you would go, because we would know where you are in the room, when you're in the room, and where we need to go from there. So there's a methodology to contact tracing and quarantine that's also part of our room layout design.
Yeah.
Okay.
Like if this was a classroom and Roxana was my classmate and I had COVID and this is how we spent all day, she could
I could stay.
She could
You
stay,
would have
and I had to
home,
go.
Ralph, but
That's
I
right.
could stay.
Okay.
You'd have to go with me, man, sorry.
Yeah, you and I are out, Ralph.
Yes, yeah. But protected because you'd have plexiglass and masks and, yeah.
Thank you.
Good.
That was far more thorough than I
Yes.
needed, but much appreciated.
Yeah, no problem.
I do appreciate that.
It's funny because those are samples, but they actually are being used, the ones that are on top of the bookcases. Yeah.
Okay, great.
And they're disinfected between every session, so just let you know that too, that's another layer. So every surface is disinfected before students arrive and after they leave.
Well, who actually does the disinfecting?
We have custodial staff that has schedules, and we also have, so that's the large-scale disinfecting, but in each classroom, we also have Brulin Performex wipes, and so every staff member and student has access to those, and they're also encouraged to do a secondary wipe themselves so that they know that it's been done. So multiple people can do the cleaning at any point throughout the day.
Great.
All right, the next item that we said that we would look at is approaches by nearby districts. Obviously, that's a pretty variable. So I don't know if there's anything specific that, you know, board members would like to discuss here, or anything, you know, the admin would like to point out to us. I think we are aware that there are as many different approaches to returning as there are districts in St. Louis County and in the state right now too. So.
I know, I asked Vince if he would compile that list, so he does have a list should you choose to see it, but I think as a general comment, one of the things that DESE is now doing that's on their dashboard, if you look at the DESE dashboard, is 2 different tables that show which configuration each district in the state is in, and anytime we would change our configuration, we are required to submit paperwork so they can update the dashboard. So at any time, if you or anyone that's listening at home would like to take a look to see, that's publicly available on a map that you can scroll across, and when you scroll across, it gives you the district information about which form of instruction they are currently using, if that's helpful to you.
I did spend a big part of the day making contact with districts around their plans. You are correct, there is a wide variety, hybrid, full 5 days, some virtual, and I have it compiled. It's certainly not an official document, but I felt pretty good about it because in the combination of looking at websites and actually making contact with folks, because this is evolving. Like there's people that are having board meetings tonight to discuss in-person instruction as we speak. So I'm happy to share this with you guys, and this is sort of an evolving database. If you guys are interested, I have it on the Google sheet.
I would like to see it.
Yeah.
Yes, please, yeah.
Yeah, and I tried to color code it so where you can see who's doing virtual, who's doing hybrid. And there's different unique models. I learned a lot from doing that. You know, some people are doing AM, PM, some people are doing 4 days a week, Fridays off, all kinds of interesting models. So I'll share it with you guys.
Okay, thank you.
No problem.
Thank you.
Any other questions or wisdom we hope to learn from other reentry plans?
I think Vince's report will be very useful.
Agreed.
Yeah, you can pull it up here in a minute. I'm going to send you.
Great. And then the final item we had asked for was the plan for handling positive cases or potential outbreaks in buildings. So I'll turn that back over to Steph.
Sure, so I did send you a document that is our protocols for screening, isolating cases, and contact tracing. I don't know if you've had an opportunity to read that. I certainly don't want to go through all of that with you tonight, other than to say our strategy is really built around 3 core pieces. One is making sure that every family does daily health screening. I'm trying not to yell into the microphone.
I'm
Maria,
sorry.
So we need every family, just like every employee does a daily health screening, we need every family to do a daily health screening for their children. We're very specific about what symptoms look like, and we have an algorithm for which symptoms actually are more high risk. So we need everybody to do that at home. If they've had contact with a COVID case, they shouldn't come to school. If they have symptoms, they shouldn't come to school. The second strategy, though, is what happens if somebody develops symptoms at school, or if their parents didn't notice that they had symptoms and sent them to school anyway. So the second part of that strategy is making sure we have isolation rooms in each building. So we do have, we've reconfigured some of our building spaces to move the nurses so that we have the general nursing area, but we also have isolation rooms where potential cases or kids that are having symptoms can be placed, I guess that's not the way I would like to say it, but you know, a holding area. The nurses have special PPE that they would wear anytime that they were working with a case that we were trying to figure out what was happening. All of those are placed next to exterior doors, so students would not have to walk through the building to exit, and so that whole isolation strategy is super important. And then the third part of the strategy, and really where all of this rests and how schools have been super successful, is making sure that we've got a good contact tracing team, because what you want to do immediately when you think that you've had some form of exposure or what we call close contact with a case of COVID is you want to identify who those close contacts are. You want to ask the right series of questions, and you want to make sure that those students then are quarantined. And if we're in person, and Nikki, you asked me this question this week, if we're in person and we have to quarantine a student, there is a provision in our homebound law that would allow them to teleconference into classes so that they can keep up with classes while they're at home. That's not open to everybody who has anything, but in those situations, we do have a workaround so that those students do not have to lose instruction, assuming they feel well enough to do their coursework. And so those are the 3 things that we really have been focusing on, is making sure that we've got good screening protocols, making sure that we have good case isolation and that the facilities can withstand, you know, that we've specifically designed that, and then making sure that we've got contact tracers. At one time I reported that all 3 nurses had been Johns Hopkins approved. My entire team has gone through the Johns Hopkins training, and we also have many of the building principals and secretaries that are in the process of completing the contact tracing, because depending on what happens, that can be time consuming. And what we've learned from districts that currently are in school is if you're prepared to do that and do that quickly, that's how you maintain no transmission in your building.
Yeah.
Quick question, Roxana. Did you say that if whether they're quarantined or sick, if it's COVID related, then they can teleconference in?
Correct.
Okay, I just wanted to make sure.
Correct, but it doesn't work, it's very specific in the language. It doesn't work for just anybody that wants all virtual, and it doesn't work for anybody that just might be home because, you know, they have a tummy ache or something that isn't COVID related. It's really, the variance is really meant to allow folks who've been quarantined for COVID or who have COVID to not have to miss. It's going to be 14 days,
Yeah.
and if your whole family gets it, it's 10 days after that for each additional family member. So some of these quarantine periods can actually go quite long as it works its way through a family.
And I know I've asked this before, but similar to what you showed in the initial dashboard of the data we looked at, there'll be a public-facing dashboard specific to the MRH district?
Yes.
For these potential cases, correct?
If that's what we go with, that would certainly be
Right.
part of it, yes. And we could even, it would be a little more complicated, just in terms of making sure the data was accurate and updated, but you know, one thing you could report is the number of students that were currently being quarantined.
Yeah.
That's a little harder, and has an opportunity to be a little messier in terms of being actually accurate in real time, but that is something that could potentially also
Yeah, I've
be
seen different districts do it weekly or something like
Yeah.
that gives
Yeah.
them,
Yeah.
and building level would be ideal as well.
Definitely.
just this morning, CDC announced new contact tracing, well, new guidelines on what is close contact.
Correct.
So I was just going to throw that out in case you
Yeah,
need to update the contact.
We've actually been using that. That guidance isn't necessarily new for us. That's
okay.
what's been recommended by the state health department and the epidemiologists for schools for weeks and weeks now. So we've been using that guidance for a while. It just made its way into the official CDC guidance today.
Yeah.
Outstanding.
Yeah, it's interesting because when I heard that, like, oh no, we have to redo. And then I thought, oh, we've already been doing that. And the difference was about defining the 15 minutes. Previously, it was 15 minutes continuous exposure. Now it's cumulative.
It's
So over the course of a day,
Right.
if you spend 5 minutes, 5 minutes, 5 minutes with a COVID-19 person who has it, it's also considered. But we've already been using that measure. So I was sort of relieved in the sense that something we were already kind of working with. Yeah, in good shape.
Ed sent it to me today, and I thought, really, something new before we have this big
Yeah,
conversation?
I know.
But was like, yes, we've already been doing that.
One of the most consistent things that, in this very evolving work that we're doing, the algorithms that schools are using or agencies around how to work with someone with symptoms has been very consistent for several months now. And it's been kind of comforting. So we're really familiar with that algorithm about how to use it, what's high-risk symptoms, low-risk symptoms. We already have a little bit of a rhythm with that, which feels good. Everything else feels newer. That feels very familiar to us already. And our nurses have been great. But that's been a relatively stable part of this whole planning in the region as well as in our schools, so.
Do we have that published too, the high risk versus?
The algorithm in terms of, I don't know that we do, and that would be a really good thing because that algorithm has been super useful for us, and I think would be super useful for parents because the guidance is if you have 2 low-risk symptoms, you should stay home, 2 or more, and if you have 1 high-risk symptom, you should stay home. And I'm not sure folks know the difference between what a high-risk or a low-risk symptom is, and so that we have a lot of graphics like that, honestly, that I think are useful, that I think folks would take comfort from and help inform them also about how the virus works and what to look for in their own homes.
I
And so
would
that's
like-
something
We-
that we can
Yeah,
certainly
we are ready to
make
publish.
available.
We've been working on documents.
Okay, good.
And now that we have a little bit of clarity about where we're going to be the next 3 months, we're ready. We're ready to, he and I were just nodding, we're ready. We got some documents ready to go. And those are very helpful things. There's a health tab that'll be created that's new for the district, but it'll also be the same health tab for the buildings where they can find information about how we're going to manage students in the building, what to look for in your home. There's a few things we'll be posting.
Great,
Yeah.
great.
And Vince, do you have any stories about how this has played out, with the small groups of students that have come? Have we had to, institute like, oh, we've got a kid on campus that we've suddenly realized is, exhibiting symptoms or something like that?
So I would say, without trying to, don't want to provide any student identifiable information, but we've had one case where that involved COVID-19. It wasn't a student, but staff, and we did the contact tracing. We actually did overkill because we did it and SSD did it, and we did the appropriate quarantining and all that stuff. So we did have some practice with that. Yeah, the students were not COVID-19, but they had a significant exposure, so they are staying home. Yes, so we've had one incident of that. Yeah, we've had a chance to practice a little bit,
Can I ask you, the kids that are coming here, are their temperatures being taken before they walk in the building?
So we did not implement the temperature taking. That was something that was discussed a lot when the pandemic first hit, and there was a lot of variance in terms of the effectiveness of that. So what we are having them do is do daily checks before they come here, but not taking their temperatures when they come. Yeah. But the parents have agreed, so when they sign the agreement to come, that's one of the things that they will check temperatures at home, not send their student to have. And actually, we outlined the symptoms that we talked about, and it's spelled out. They have to initial all those. So they do daily checks at home, which is actually what all the districts are doing right now.
And that was our recommended guidance for 2 reasons. One, because temperature is one symptom, but it can be unreliable. You can have false highs and false lows. But also because they're afraid that if we take the temperature of every child when they enter, it will cause bottlenecks at the door, which actually might cause more transmission risk. And so the strategy is to ask the families to do the daily health checks at home. And then we do visual verify of the adults in the building. If you see someone that you believe is exhibiting symptoms, that's when they would go to the nurse and we would start the isolation protocol.
But we have purchased a lot more thermometers. We have about 30 extra. So if people need them, yeah, they've come in handy.
Yeah.
There's one by outside Roxana's office.
There's one in my office. You can go take your temperature right now.
I did it, like at the other day, I'm like, whew. Maybe I should go home.
Pretty much as the staff taking the temperatures themselves?
Yes, they're supposed to do a daily check-in, which talks about all those things as well. Yeah.
Now, the one exception is, according to current county guidance, for students that we have doing conditioning training on campus, they are required to temperature check every day, and we have provided thermometers, and that is happening for the athletes, simply because those conditions, because of the extra respiratory, you know, it's a little more higher risk than sitting in a classroom, and so they are getting a daily temperature check.
All right, any other questions around the plan for handling cases? Okay, well, thank you for thoroughly reviewing that data with us. I think we can move on to the next agenda item if board members are comfortable with that. So the next agenda item then is just this continued transparency on the tier determination. I think the purpose for us, as Francis has foreshadowed here, is to get clear about the data that we'd like to report to our community, and you know, the specific impacts to students and staff on quarantines or, you know, positivity, and things of that nature. I have looked at dashboards from many of our peer districts. I'm sure everybody in this room has. So it's clear that there's a lot of things that we could include, but wanting to, I think, proactively get that dashboard going, so that we have it for when we do bring more students into the building. But would like to have an opportunity to discuss if there's, you know, particular dashboard that folks have seen that they like, or particular metrics. And we should obviously talk too about the time period for updating. This isn't necessarily something that's supposed to be up to the minute. It is one of many communication vehicles for us with our community.
Kate, excuse me, I just have a question. I want to make sure that I'm in the right agenda item, but excuse me, I really would like to get an understanding of what our administrators are looking at when they are saying that they're comfortable with doing hybrid, and what are you looking? Well, I'll just ask you directly, Roxana. So we talked about this probably, I think, yesterday, and so I just wanted to understand what number are you looking at? Because when I say number, I'm thinking of like that positivity rate that we talked about that was like in the county, I think it's like 1.03, right? And so I'm like, okay, if it's under 1, is that when you all are saying, okay, we can go back to 5 days? If it's, you know, 1.12, then is that we need to be in virtual? So can you tell us that?
Well, so I'm going to give a very it's unsatisfactory when I hear it, and it's unsatisfactory when I say it. I don't think there's any single number that is going to tell us that. I think that we're looking contextually at all of the numbers that I just showed you. And so generally, if we go back to that CDC chart, if you remember that color-coded chart, what we talked about, Nikki, was, so some districts have all students back on site 5 days a week, and some students are doing the hybrid with half the students on campus for a couple days a week, and then the other half for a couple more days a week. And so it's a more blended approach. And there are a lot of reasons why you would do one or the other. And honestly, I could make a great case for either scenario, honestly. Typically, districts that have a lot of students and not very much square footage pick our tier 2, that half the kids on campus. And the reason that they pick that is because one of the important factors, contextual factors on the CDC data, is one of those layers of protection is being able to ensure that students stay 3 to 8 feet apart, ideally 6 feet apart. So if you've got more kids than like we have on this campus, trying to get them into a small space, you can't, social distancing cannot happen adequately if everybody's here, right? So one of the contextual factors is, can you operate your layers of protection, of which social distancing is one? So our tier 2 is really designed to make sure that we can have that as a layer of protection. So if we look at the other rates, if we look at the positivity rate, if we look at the transmission rate, and if we look at the number of new cases, the higher those get, the more we need the social distancing. As they become lower, social distancing becomes less important because you have less chance of active cases and active spread. So it's not a number, it's looking at all of those things in combination with each other, if that's your strategy. Now, there are other districts that I know that decided that because the hybrid approach with kids on campus 2 days a week and another group 2 days a week is theoretically harder on families and it's harder on teachers, that they are just going to take the risk and they're going to cut back on the social distancing, bring all the kids back on campus, and then your strategy becomes highly dependent on contact tracing, isolation and contact tracing. So your idea is, we know more kids would be quarantined in that scenario, right? Not necessarily more transmission, but you know for sure more kids are going to be quarantined. And so if you choose to do that, probably, based on what I'm seeing happening elsewhere, teachers are also going to be teaching with some kids at home and some kids in class. The difference will be that it's not a schedule that they're on. It will be based on how many kids have to be quarantined because there will be more close contact because the social distancing could not occur. And so I think that's important that you all understand that all of this is contextual. It's not a number. And both of those strategies are in play, and I will tell you that different teachers and different principals really advocate one over the other. And if you remember, our initial proposal to the board for K-6 was all students on campus, because we thought we could cohort, and we thought that, you know, instructionally that might, and they have less chance of positivity based on the data. We initially thought that might be a better strategy. So both of those strategies could work. It really is, you know, what do we have tolerance for, and what do we think is the least disruptive to a student learning environment? Because both have pros and cons, and both are likely to result in some students being off campus at any point in time. It's just a question of how. One is planned, and one would result as potentially more quarantining, because we would not have the social distancing, which means more students would be close contacts to a positive case. Wow, that was a lot, but hopefully you followed me.
I did. So, looking at all of the information that we are talking about putting into a dashboard, I know this is the same question, but different, just slightly. How long would we have to look at all of that information before you all got to a point where you said, you know what, it's been low for so long, we could go back to 5 days?
That's a loaded question.
No, it's not. In fairness to me.
It is, because I don't think that's realistically, statistically going to happen when you look at the way that this has so far gone from March till now. There are spikes and swings, and, you know, if you're looking for a consistent single number.
No, I'm not.
Okay.
In fairness to me,
Okay.
I said, looking at all of the data that Roxana said, you know, because in my example, my first example, I
Right.
did give that one number.
Right.
But she's like, no. And I'm
Right.
like, okay, Roxana, I'm with you. We're looking at everything.
But you're also looking for a consistent period of time, you mentioned, for several weeks in a row.
Yes,
of the same.
because I guess my question is, like, are we looking at being at hybrid for, you know, the rest of, if we go back in January, which is what I would like to do, are we looking at hybrid for the rest of the semester? And I'm not trying to make it a loaded question.
It wasn't.
I'm just like,
it wasn't designed that way. And I will tell you for whatever it's worth, I'm going to tell you my personal comfort level. Okay. And we could argue that, because I can argue with myself, and I'll probably go home after I say this and say, well, no, I've changed my mind. I mean, honestly, that's what this is like, right? But my personal comfort level is, if you look at that CDC guidance, if you look at the highest level in red, I'm saying all virtual. If we see us hanging out there for a couple, 3 weeks at a time, that's when I would recommend that we go back to virtual. And if we look at the other end where it says lowest risk of transmission, which is less than 5 and less than 3, if we can hang there for a couple weeks, I would say all kids back in the building, and I would be comfortable with that. And everything else in between, I'm looking at a swing, because for me, based on what I've seen just with staff and who has to go home and who stays, the social distancing is an important part of our layers of protection and mitigation. Now, I will tell you that when I talked to one of the health department epidemiologists and said we were putting in barriers, they told me that plexi trumps space. So if our plexiglass goes in correct, and if we watch how that's actually used, I might change my opinion after I see students in the space. But right now, that's my personal comfort level.
Thank you.
I'm sorry, Roxanne, what was that about the plexiglass?
What they said to me was that the physical barrier trumps the space. So if we have physical barriers in terms of transmission between students, that's better than 6 feet.
Yeah.
Oh, I see what you're
Yeah.
saying, okay.
Yeah.
I have a question. It's a question and a statement, kind of. So, in the courthouse, and I realize this is a school, so I'm not trying to compare it, but we have a threshold, right? You have to hit a certain number, certain other things have to take place, and then we know we're moving to a different tier. What are the chances of having something like that? And let me say this: what you just said sounded like that to me. And I would love to have, okay, this is what's tier 2, this is what's tier 3. If we're all comfortable approving that, right? Maybe we tweak numbers or whatever as we're deciding, but that's what it is, and we vote on that, and then we're not necessarily having to constantly put you guys through, what are we doing? What is, you know what I mean? Is that a possibility to actually have? Because today was the most thorough I've seen ever, in what we've considered and discussed and how we've discussed it. I feel like I have a better understanding today than I've had any day prior to.
Can I ask a question on
Absolutely.
your question that's related, and I don't want to step on it? With the initial presentation that Roxana gave, that covered all of those different factors and where the data came from and got down to sort of central corridor type numbers and everything else, and then if a recommendation came around that, I mean, does that type of presentation start to answer some of the questions that you both are, I think, posing in different ways?
To me, I won't speak for everybody else. To me, it does, and it allows me to say, okay, I'm not comfortable with 10%, but I am 8. Or I am, it starts I'm just giving you an example, but I'm saying it starts that conversation of, okay, this is where we are, this is what you're recommending, and it doesn't have to be hey, we're just, you know what I'm saying?
I think, yes, to answer your question, Francis, because of what Roxana just said about, right now I am comfortable with following the CDC's recommendation or that table for school, reentry, or just that, right? And so for me, I need to be able to tie the information that we received to why, and get an understanding why administration is saying, okay, we're going to be in hybrid because of all of this information, and we are following the CDC's recommendation. Or we need to be back in, the virtual because of all of this information, and we're tying it to that. So now that I know that is the two, those are partnered, yes, I feel so much more just clear on understanding.
The other
Vince
thing-
wanted to say something.
Well, first of all, these are great questions. The thought-provoking for us as administrators. The other thing that all of us will have to look at additional data points, if and when we go back to hybrid, and we're trying to make a decision about whether or not we go back to 5 days, is our own internal dashboard about how many kids
Yes.
Yeah.
of COVID-19, which,
Yes.
which we don't have yet, of course.
Right, right.
So, and I thought about that because we have a daughter who's in college, and she's going to school in a county that's got pretty high rates, but her school's doing a great job. So while there's a reality of high rates in the county where her school's located, in their campus, they're doing a terrific job. So they're looking at county rates, because they go shopping and do different things, but they're also looking at their transmission rate on campus. And that, we'll have that data in addition, when we go back hybrid, we'll have that in addition to the things in the county, which will be even more helpful for us.
There's
And I think
also clear recommendations around that, and what percentages are your thresholds, and what does that look like? I did not provide that to you this evening, but certainly we can do that.
I think that's gonna
Yes.
be helpful to everybody. Everybody. So yeah.
Is the determination, and maybe this is an unfair question, but for the K through 6 groups of children, with the populations of students that we have, and I know it's somewhat fluid to have exact numbers, you said earlier that, the recommendation that you were thinking about bringing forward was 5 days a week because we could socially distance within the buildings that those kids were going to be in. Is that still something that the administration feels?
So that was the recommendation we brought you in July. We could not socially distance 6 feet at that rate, but we could cohort students. So we can guarantee that young students stay with the same set group of kids throughout their entire day, through lunch, through recess, whatever, which we obviously can't do for kids that change classes on this campus, which is why socially distancing on this campus is a primary form of strategy. However, since that time, what the principals have said is, and I think you heard Cindy say this to you the night that she visited with us, they really did want to start in Tier 2 because they want to practice with smaller groups of students and work their way back to all kids on campus.
Correct.
Because I think that they are just worried about, again, when you look at the CDC table and you've got the layers of protection, you got to make sure all of those are working, and it's easier to make sure they work. To Vince's point, we're practicing now with our small intervention groups, and then we move to a hybrid model with half of the kids at a time, and then hopefully in short order, once we get comfortable and we're sure that the isolation, contact tracing, and things are working, and if the community conditions don't worsen, we'd then be able to transition back to more students on campus. But I think you have to look at that phased approach. We built a tiers model so that we could have that flexibility and we could react to local community conditions relatively quickly. Nobody wants to make families or teachers feel like they're on a roller coaster, and that's the other thing we have to talk about. Staff have a very real concern because every time we change tiers, that's a huge disruption in their skill set. That's a huge disruption in their planning, and so we certainly don't want to discount that as we talk about this process. They're tired of hearing me talk about blended learning and blended planning because you can pivot from that. And I can say it all day long, it sounds easy, it is not. And so every time we make an abrupt transition between tiers, it has a significant impact on the time that the staff is spent planning as well. And so, I wear 2 hats, and one of my hats is thinking about how that goes and that our quality of instruction remains high despite the tier that we happen to be in. And so I do think it's fair to say that as well. That's also one of the considerations about when we move tiers and how quickly we move tiers and how that will work.
And I appreciate all of that discussion. I just think it's also worth mentioning that let's think about, I have the utmost respect of what's going on with our staff right now, and they are paramount in what I'm thinking, but I'm also thinking about the inconsistency piece for the kiddos. And right now, the heightened stress level that we're hearing and seeing in the community from our kiddos that are, it's run its course right now with virtual, that moving back and forth, we have to be mindful first and foremost of the impact on them and their families. And I think that's palatable. I feel it. And one thing that I wish we would have more conversation around is the word kiddos in this conversation, because we do talk a lot about staff, we talk a lot about us, and I know it's always in everything that we think. I have no doubt that the 7 of us are always trying to do what's right for kids, but we don't always articulate that, and I think it's important that we say it out loud, that first and foremost what we have to do is right by our kids.
Yep.
So let's not let's not let that be lost, and I charge all 7 of us to make sure that we put that out there constantly.
Agreed.
Can I ask a question? I appreciate that, Maria, I just want to say. And kind of related to what Maria just said, can I ask you about juniors and seniors? They are heavy on my mind because they are the groups of kids that are looking to leave our school district the soonest. And so I am wondering if we can start having conversations. I know that we've focused very heavily on our young children, and I do believe that they are vulnerable as well. All of our children are, but when I'm looking like, specifically, I'm looking at our little ones, and then I'm looking at our juniors and seniors. And so I know we focused a lot on them, the little ones, but can we have a conversation about the juniors and seniors? Is it possible for them to come into the building? What would could that be a possibility? What does that look like? I know Maria and I have talked about it, and we differ on one group. Maria said freshmen and seniors, and but is it possible?
Actually, can I chime in real quick before you answer that? Nikki, I wanted to know that that conversation enlightened me, and I actually changed, and I think it actually should be juniors and seniors based upon sequencing. So thank you.
Thank you.
Well, anything is possible.
Okay.
So, we're MRH. We do things,
We're
but
MRH.
it really just depends on, what our intent is and what you mean by that. Is it, I would want to have a much deeper conversation first with the high
Right.
school to see what their thoughts are, both with the administration and the staff. And then, based on what they're thinking their needs are, I'd like to come back and talk to you more about that.
Thank you.
Perfect. I would like to say something too. When you guys brought it to us about our kiddos that we have identified as really needing to have some interventions, was more than happy to vote on that. I would be more than happy to also, if you guys are identifying any other groups or any other, I realize everybody needs it, right? It's everybody, but if it's, hey, our juniors or seniors are suffering and we feel that bringing them in a different environment or a different way, I want that stuff to come to us because I feel like you guys know because you're working with them. We're not in that realm. We can't say, hey, it's great that Nikki thought about that and that Marie thought about that, but what about the things we're not thinking of? You know what I'm saying? So I want more of that to come to us. And I'm speaking for me, I'm sure the other board members would like that too, but just to have, these suggestions about, hey, this is what I think we need to do, because we are MRH and we do think outside the box, and everything doesn't have to be cookie cutter. I would love to just have those innovative ideas of things that you think would help our students, our kiddos, that we haven't necessarily thought of up to this point.
One of the really helpful things that this board did for us, and for the community, I should say, not for us, for the students, is when you approved the on-campus interventions, and we gave a decent presentation about what we were thinking, but you allowed the buildings to have some flexibility already to be able to be creative without having to come back here every time if we want to add a group of kid. Because I always they're very respectful of the role that the school board plays. And since you approved the on-campus intervention, I get frequent emails from my administrative colleagues say, hey, do you think we can do this like this? I say, yes. The board approved on-campus intervention with site-based management, and they've given us some flexibility to really be creative, which has been really helpful for our students and our community. So there's already kind of a built-in flex, like, can we increase the days? Yes, if there's a need. Because and we'll talk about this, I know it's on the agenda, but we've already known that now that we're going virtual till January 22nd, that there's going to be a need to look at the on-campus interventions and perhaps expand it a bit. So the board was very helpful in terms of allowing us to support students during this time.
So then back to the agenda item around, metrics. I think that the development of this dashboard that includes, the public health, or DESE, health, indicators that Roxana's presented, as well as the opportunity to see, staff and students who have, been quarantined or, tested positive would be helpful. And I also think that it's a once a week, dashboard update. I think we just say it's updated on Monday or it's updated on Wednesday or whatever it is. Y'all figure out whose responsibility that's gonna end up being, and set it, but that I think is something that's gonna be, again, another helpful tool. The one thing I will say that I think would be helpful for me is I've seen some districts who, only show that snapshot for the week and they're not, memorializing any of the historical data. I'm fine with that. I just would like to know whether things are trending upward or downward, with both, the number of cases of kids or staff in our buildings, or the number of students or staff being quarantined. I think that would be helpful as well. Other thoughts, concerns? I mean, potentially we can see a strong draft and we can say, yes, go live with that fairly soon.
Yep.
So, just a point of clarification in my mind. So, I get, I agree with all of that. Like, we should be looking at data in whatever frequency makes sense. And then those same, are we saying, or is this another point of discussion, are we saying then that those metrics that we've just discussed form the framework for also like a summative decision on second semester, and it's going to be those metrics that the board uses to determine, well, that we're going to ask the administration to provide us for their recommendation for second semester in-person learning? Is that a fair assessment of what we're talking about here?
Yes, for
Okay.
me.
Yes.
Yes.
I think it has to be like a definitive yes or no, because I feel, and correct me if I'm wrong and speak freely, I feel like there's some confusion on the administration standpoint about what it is that we need to see in order to support their recommendation for second semester.
Okay,
And
let
I
me-
feel like under the gun that this needs to get clarified, the community needs to know what those metrics are, and we have to be presented with options for the community sooner rather than later.
So let me say
Agreed.
this, I look at the recommendation as part of that metric, because I'm looking at the data that's presented to me. I'm taking into consideration the recommendation. I'm taking all those things into consideration. I'm not saying, okay, they have to support their recommendation, because there are administration, like, when they say this is what I recommend, I take that very seriously, and I know that it's with all this stuff in mind, but I'm also looking at that data and saying, okay, well, this is rising, or this is doing this, and what does that mean? And so it's not just a vote on the recommendation, it is a vote on whether or not we're returning or going into that tier based on all of those things is where I was. I can only speak for me.
But isn't that the recommendation?
No, the
I'm
I'm
clear.
confused. I need you to clarify that one.
my understanding is, and correct me if I'm wrong, Roxana, because the recommendation has been for a while to return to in-person learning, tier 2. Is that correct? Okay. That's been the recommendation, as I understood it, for quite some time, as the data points that we've been reviewing have fluctuated. But there's a legitimate reason for that.
Right.
But I've been looking at the data as it's fluctuating and also asking for, and now we have these other things that are going to go into the dashboard that help us say, oh, okay, well, everybody's going to be social distance, or everybody's going to have, like, these are the other things that contribute, as you said, the triangulation
I'm
of
gonna
it.
make you a data person yet.
Exactly right. So that's kind of how I was looking at my own, I guess, triangulation. So if you guys want to come up with, this is the board triangulation of how we're going to vote based on this data, I'm fine with that.
I thought that's what the
I think the
discussion was about
recommendation is a
tonight.
part of that.
I'm hearing two different things, and maybe it's just
Okay.
me, so I don't know if anybody, I'm hearing like and maybe we're saying the same things and just saying it differently.
I think
but
so.
I think there needs to be a set standard of metrics that they're going to report on that includes a recommendation, and we have to stick to those standard of metrics and use those to either approve or deny the recommendation.
We're saying the same thing.
I told y'all.
Okay.
Yep.
Okay. Because I heard you say you're using your own triangulation,
Yeah, that's
and
where I
No,
I'm looking at
of what's
different-
been provided, and of what, I think we're
Well,
just looking at the data differently.
Well, it goes back to, we were given multiple sources of data, and we collectively as a board didn't synthesize that, right? So
Right.
you were going off a data point, you're going off a data point, I'm going off a data point. Now we have 3 solid sources, which have been given to us
Right.
the whole time, but now they're synthesized by
Right.
someone.
Right.
And explained, and if we can accept that,
I
that
think
those
this-
are those data points,
The second part of that is.
along with the
Oh, sorry.
recommendations.
Yes, but the second part of that too, and maybe we can fix this, is, for example, we're talking about 10% transmission, no, 1%, right?
Well, it
1
depends.
point.
It depends on which data
Right.
point we're talking about.
Right.
There were several,
Right.
there were
So it's
several
not crystal
ranges.
clear, like you're gonna be able to go right here and into that.
Well, I'm saying that, I guess, I'm assuming that some of us are saying, oh, we're at 1.7, not comfortable. Some are saying, oh, well, I'm comfortable going back at that because, or, do you see what I'm saying? So are we gonna say, hey, it's gotta be under or over this number, or?
we're not.
If
Okay.
I could point you back to that chart, I'm going to say it this way. I think you can use those metrics very effectively, but I think you're going to have a hard time using a single measure.
Right.
And maybe I can make an analogy that'll make that clearer. So if you have a student that's in 7 different classes, their overall GPA tells you something, but not what you think it does if you look at their individual course
Exactly.
grades, right? Because they might be making A's in all of their courses and failing one, and so their GPA, if we looked at the aggregate, would be maybe good or maybe bad. This data works the same way as that analogy, so we have to look at those pieces together. That's why I gave you the table, because it might be that the data is still within an acceptable range to be on campus, but means that our layers of protection and the precision in which we have to control movement in the building and how serious we have to be about PPE is much higher, right? Which is why we would start in a tier 2. But if those numbers start looking better, then maybe, you know, those layers of protection get to ease up. And so they work in tandem in that way, which is why I would suggest you, again, you can put anything you want on your dashboard. That's why I made the suggestion of the pieces that I made, because those are the pieces that tell us what's the risk of transmission, how many cases are we likely to have that we would have to contact, trace, and quarantine, how does this look in terms of exponential growth so that we know how serious we have to be about social distancing, we know how serious we have to be about PPE, you know, daily health checks. If our zip code data looks really good and families are doing a really good job in the community, then I have less concern about daily health checks, right? If it were running rampant in the community, and I knew that, then I have to do measures here at school to countermand what I see happening in the contextual community. So that's why I'm saying we can't look at one single data. We need
Right.
all of them. And so if I were to bring you a recommendation, that recommendation you could include, would include, here's the data that I'm looking at, and based on this data, here are the things that we have to be really serious about doing in this environment.
Okay.
Does that make sense?
Mm-hmm. Absolutely.
And I think you can certainly ask about a data point and why, if it's too high for you, why in this metric of multiple data points, why does the administration feel more comfortable going to tier 2 from tier 3 because you're concerned about that number? Tell me why, what are the mitigating factors that help them think
Right.
this is a better move, right?
Right.
But we just have to stick to those metrics is all my point.
I don't have a problem sticking to the metrics that we've decided on. No.
And I'll just say, I like the metrics that were in your presentation.
Yep.
Okay,
Agreed.
good. All right. Then let's,
move forward to the return to learning plan components. I think we all acknowledge that there's been intense work that has happened amongst our staff and our administration since March, with, figuring out what schooling in a new reality would look like. I know that over the summer we did have, presentation on some of those high-level data points around, or high-level sort of look at the plan, and then building level plans were developed and disseminated. And I think that we've have not looked at those recently. I think obviously some realities have changed, and wanted to give an opportunity to revisit those. I don't think we necessarily need to go through all of those plans this evening, but to know that those plans exist beyond a timeline for reentry, that there is actually like new protocols for how various things happen, and to be able to be really clear with that communication to the students and the staff and the families who will be re-entering buildings. So wanted to turn that back over, and I think it is important for us to endorse those plans going forward as the things that we believe will happen when kids are back in the buildings.
I tried to send them to you with a little bit of an explanation that isn't necessarily here. So you really received 4 levels of plans from me. You received the very high level matrix that just listed all of our departments and the areas in those departments that we knew we had to plan for. So that was the initial document. Then you received a document that is listed here that says tiered approach to pandemic responses, that has everything broken down by tiers, and it has live links to the CDC recommendations that those plans were based on. And that was created as a working document by the original task force that was comprised of all of those stakeholders, so that we could ground the plans in the best practice and have a philosophical kind of framework that we could return to make sure that if we were making changes, we were making those changes in accordance with guidance. And then the next plan that was developed that's attached is the tiered response plan, which is a very high level district level plan for each of the departments and the components that would need to take place. And from that district level plan, each building then developed their building plans in the areas that applied to them. And so you'll see that's where the very specific kinds of information is living. I also indicated to you that's not the last word, though, because there are teams of folks who would be carrying out those activities in the building, and I do have samples of some of those if you'd be interested, in terms of what does this actually look like when it's happening, right? So we have diagrams, and we have, everything from charts of how kids will move through the building at the elementary school to make sure that they're not crossing paths on their way to and from the restrooms. And so I don't think you want to be in that level of weeds, but I do want to let you know that that's the type of work that is happening. Okay? And I'm not really going to talk about it other than that unless you have specific questions.
I just really appreciate that the plans are in place. I mean, I knew that the plans were in place. I appreciate the plans are in place, and I would caution the board not to get too in the weeds on some of these plans, because we are not the experts inside the building. And Nikki, you always hear me say 30,000 feet, right? Let's let our building administrators be the experts that they are within those plans.
Agreed.
I agree. My only concern is, or it's not even a concern, I think the community has questions as well, right? Because they're sending their kiddos, our kiddos, to the classrooms, and so I know that one of the things I've heard is, what does that look like? So I don't think that we do anybody a service by getting into the weeds, but I do think that maybe just the basic level, okay, this is what we've done, and putting that out to the community so that they're aware, so that as Vince said, anxiety is a little bit calmed, like, oh, okay, there, you know, because it's one thing to know there's a plan, but it's another thing to at least
See.
have a hint of it. Oh, okay, that's, I understand now, right? So
I think that-
I would like that.
I think that's super important, and that's something that I have, Vince and Chris and Ed and I have talked about. I also talked to Katie about it. I don't know what we call it, but I will acknowledge that while we've been very thorough and very technical with our operations plan, we have not done the kind of job I would expect us to do in terms of a public-facing document that everybody doesn't need to know the level of detail that our building administrators know, but everybody does need to have some sense in an accessible way to know some basic things about what they can expect and what's going to happen. And so we have not done the kind of job that I know that we would like to do, putting those forward into some kind of communication plan to the public. And if you all are comfortable with those operational plans, that's an easy enough thing to do, and something that Ed and I have already discussed would probably be a task that would come forward out of this meeting.
Yes,
Absolutely.
Please
I
go
think
for
so.
it.
Thank you.
I may be speaking out of turn, but I did had the occasion to watch other boards, as I've mentioned to you guys, operate in their meetings. And it's my understanding many of them weren't even releasing their plan until they knew exactly when they were going back. So now that the board made the decision not to go back, I think getting that plan out sooner, because my expectation, and I think we shared this, is that, you know, we want to be able to tell our families when they can anticipate that. And if that's one more
Absolutely.
thing we can put to make you all feel more comfortable about voting to get us back, I think we need to get that out there into the community.
Agreed. Absolutely.
And just as a point of order, I think those attachments you spoke about are in
The first,
2.01.
yeah, they are.
Just if people are looking for it, so.
I recognize that our board docs guru was not on campus this week, so yes, I appreciate
I just want to make sure that
with
if
some
anybody's looking
pinch
for.
hitting going on here. So yes. All right, great. Well then, we'll move on to that final agenda item, supports while remaining in the virtual tier 3. Just again, want to acknowledge the heaviness that our families are carrying right now, that this is not easy, that this is a struggle. I know that even despite the opportunities for kids to come on campus for some targeted interventions, there's still more need. And so I think there have been a couple of things that have come up consistently as themes: the idea of mental health supports for students and families, the idea of academic supports, general supports for families, and I think that may mean, you know, folks who have lost jobs or folks who have been furloughed or things like that, and then supports for teachers and staff who, again, also have their own families, have their own, you know, lives that they're juggling, as well as the differences of teaching virtual versus in a classroom and things like that. So I am curious to hear either things that are being proposed new or potentially things that need to be, you know, new budget considerations or things. I think we all as a board are committed to serving our community as best we can, even beyond the academic support. So if there are specifics in this space that y'all have been waiting to bring up, please bring them up. Or, you know, let's also reaffirm that, yes, if there are kids who can't get access to interventions because they don't have transportation, that is our equity policy in action. We have got to provide transportation then so that those kids can get here.
Yeah.
So, you know, again, this is more of a discussion, and if other board members have questions or advice here.
I'll give you a few, and then I'll let Vince talk, because he's been out and about in the buildings too. Based on our last board conversation, we have posted additional teaching assistants in each building. We've actually have the one that you hired at the last board meeting on site in the middle school right now. And they are serving the purpose of, the middle school had a critical need just because of the all virtual students. But they are spending a lot of one-on-one and live time with kids to support learning. What we're hearing about interventions is we do have students in each building who are really struggling with unsupported virtual learning. So the big ask right now for all of the buildings is to get those kids that have dropped off the radar or for whatever reason are having a hard time engaging at home on site with an adult who can be with them in a classroom, and they're still participating in their regular classes. I told Katie today we had 8 students on site from 10 a.m. to 2 p.m. with a TA working, and 5 of them stopped to thank us for allowing them to be here. They said they really needed it. It really made a big difference. So that is happening. I know at the elementary school that they have they'd like to run, she said, about 25 students in a morning session and 25 students in the afternoon session who also need additional academic and or social emotional assistance that they could be working with in small groups. A lot of that planning is to bring kids in and work with them in the hopes that we get them back on track and then cycle them back home and bring in the next group so that we're continually touching more and more students in terms of meeting, which of the needs that they have. We talked to you about busing, so we have identified those students and we'll need to do some busing. We also are serving food here every day to a number of families, and I do want to say this on behalf of food service. They do not have to be our students to receive free food. So if there are folks who have children that need food assistance, you can use our food service at this time, and we do encourage anybody and everybody that would need that assistance to come. We have the food, and we are able and willing to serve any children that would be in our community or the wider community that could make it for the food pickup. But we've also identified that if we have kids on campus, we may need to do sack lunches or things, if they need to eat on campus. Vince, I know I'm forgetting lots of things, so I'll let you.
No, you did a nice job setting me up. Thanks, Roxanne. So what we are seeing is what we kind of predicted is that we would initially offer on-campus intervention for those groups that we knew needed additional support. We also knew that there would be a group of students that becoming more and more disengaged, and that's the next group that we're seeing that need to come on campus. So, and all the principals have been very creative. They have sort of a jump start approach, like kind of Roxanne referenced, getting kids on campus for intensive, short intervention for a couple weeks, see if they can get them re-engaged and then bring in more students. Transportation will be a part of it. We saw that a lot of families were able to successfully get their students here, but not all. And so that's one thing we'll need is transportation. Our transportation department is outstanding. They're very customer friendly. They're excited to do it. Not just willing to do it, they're excited to do it to help support our students. So there'll be transportation, which I think will increase our on-campus interventions. We're increasing kids' time. We have a couple of homeless students that we're bringing back here through cabs, and they're struggling for a variety of reasons. And we had one kid coming 2 days a week. Now we're going to increase them to 5 days a week for an hour and a half. Those kind of things are much appreciated from families. And so we're going to be expanding. What I'd like to do, I think, and I could report this back to the board either through critical issues updaters, just to let you know how the on-campus interventions are working in terms of number of students we're serving, and just so you can track the expansion of that. I think that'd be relatively easy to do.
Yeah,
so that's what's happening on the academic side. We're being really creative about that. On the community side, there's a group that's been resurrected in Maple Richmond Heights. We're going to start a community response team. It's a model that's been around for many years. We had a very active community response team in Maplewood when I was a young man in the 1990s. It was outstanding. And what it is, it's a group of school staff and local social service providers that get together once a month to staff families and provide resources while we're sitting there. The reason why it works is because as you begin talking about families and their needs, the people that are providing those resources are at the table, and it makes it really effective. We had our first meeting this week, and this is going to fold in Maplegood, the Children's Division, all kinds of folks, all the stakeholders, churches, counselors, those folks. It was really productive. Parents as teachers, special school district, our social worker, SSD social worker. I'm excited about doing that again. And so that's happening to support families. And on the mental health side, our high school counselors hosted a kind of a wellness mental health check-in as a kind of a psychoeducational event for the students and families last night. talked about kind of meditative practices and self-care and those kind of things. So I think we're going to need to expand that kind of work also. Our counselors at K-6 are regularly visiting classrooms as part of their regular classroom guidance as well. So I'll continue to update you guys about how we're expanding those on-campus interventions. I know that'll be critical these next 12 weeks to really expand and really be mindful about what we're doing there and being creative as well. And removing barriers for our students like transportation, now that we know it's been there.
I wanted to speak on the transportation, Vince, because I don't know if you recall, I remember asking you about that, and
yep.
you were like, we're not there yet, but we may get there. And so I just appreciate how thoughtful you all have been with interventions, and always thinking, well, I know you asked that question, I'm not going to answer it, but if we need it, then yeah, we'll do it.
Yeah.
And you're doing it. So yeah, just thank you.
And Mike and Cindy Northern, Mike Whalen, they already met. They were like ready to ready. Like our folks are ready. And the buses drivers are trying to get out a little bit and dust off, their skills and get the buses running. So it's been helpful. Oh, the other thing is, thanks, Dad. Because you approved you gave us permission to set up the special school district on-site clinic, we're going to be able to do assessments here for students because they are backlogged on the special education evaluation. That's going to start next week. Got a space for them, and it was much appreciated. So, and actually, it's going to be great for our students because they can do that on campus here. So, upcoming attractions. Thanks, Ed.
I do have one quick question. I just wanted to get clarity on something. When you said unsupported virtual learning, or unsupported virtual learners, are you talking about those who don't have an adult at home?
Yes.
Okay, that's
Yes.
what I thought. I just wanted to make sure.
We've received a lot of communication from parents who are saying, because both parents have to work, they may have young children, 7, 8-year-olds who are home with brother and sister who's 15 or 16, but they're in school as well.
Right.
And so there's just some concern about particularly our younger students being able to navigate what they need to navigate on their own if there's not an adult available to also assist them on their end. So that's what I meant. Thank you for clarifying.
That's what I thought. It's something I wanted to address, but you had already addressed it, and I just wanted to make sure.
Yes.
Thank you.
And Rosanna, you said the parents they reach out to you all?
A lot of times,
Okay.
yes. A lot
yeah.
of times, yes. Actually, I have a call tomorrow of, they'll call and say, if my child has a need, can I talk to you about that?
Great.
And so we, obviously, all of us are more than willing to listen to what would make that scenario better.
Can I ask about, I know that there was a critical need for middle school with the all virtual learning. And I know we also talked about looking at more TAs to assist with some teachers that are in all virtual but have heavy classes. Are we still working through that?
Yeah, so we have TAs posted for every every building right now. And so we've hired one. We have 3 more that are currently posted, and we'll get those in place and see if that helps. And if we need more, we'll revisit. But that's currently the plan. We want to make sure that when we bring staff in, that you've worked with me for a while. I want to make sure that we've got good plans, that it's being well executed.
Yeah.
And then if we see that we've done that and we need more, we'll get more.
Yeah.
Okay. Are we also starting, or well, not we, but I'm assuming you all are also starting to look at, the second semester. And so are you all talking about the possibility of some parents saying, we're still not comfortable coming back and we're looking at doing second semester all virtual?
We need to have that conversation at the November board meeting,
Okay.
actually. MOCAP is always available, so even in non-pandemic times, virtual learning is available to families that want it. The question really isn't whether or not they can do it, because they can. The question is how many people want to do it and how does that affect our staffing model?
Okay.
And it gets real tricky, as you've heard from ECC, because there's a number where the virtual classes get too large, but pulling a teacher out of rotation then means that the regular classes get too large. And so it's always a balance of how we go about that and what we think we can manage. And so getting some sense of that early is super important. So we need to talk about that and what that registration looks like. The other piece of that is we were able to manage virtual learning with MRH teachers K through 8, which is really great because the more they're with our teachers, the smoother that transition will flow. But at the secondary level, we had, because of certifications and numbers, we had to outsource to Launch or MU Online. Because of just everybody scrambling in the state and our late start, we did have some of our high school students who ended up starting their coursework up to 2 weeks later than their peers in the launch courses. And so I'd really like to make sure that we get our registration period earlier, so that if we do have students that are enrolling for launch, we get them enrolled early and they don't have that delay. Although, because of our late start, their first semester might be ending at the time that the statewide launch and MU classes are starting. So there could be some overlap, but I would like to minimize that disruption for them as much as possible. So that's something that I'll be asking you about at the November board meeting.
The last thing I would add, I forgot, I just remembered, it's the Weekends on Wheels is going to start. We were, the Discover Club employees that are always willing and ready to help us, help prepare the boxes, because we don't have the student interns to be able to do that. But Nicole Benson, who's a faculty member in charge of that program, was able to use our Discover. So we're ready to launch that in the next couple weeks too, which is good. Yeah.
All right. Any other questions on additional Tier 3 supports? Again, I think we're all really open to hearing how we're going to continue to support the entire community through, you know, the holidays here and into the new year. Great. Then do I have a motion
Well,
to?
Wait a minute.
Right before we
Oh,
do that.
you go ahead.
Sorry, go ahead.
No,
I just wanted to piggyback a little bit off of Roxana's last comment about the timeline on MOCAP, and to maybe to the board talk a little bit more about timeline on where we sit with. I think we gave some responsibilities to the administration to go collect some more information. We talked about staff survey and a number of other things. I think we have some good clarity on the metrics that can be brought back to us, but you know, other districts are already sort of making their plans as far as asking their community for what they want, you know, which option they're going to choose, and we have to basically, there's some decisions we have to make before we can even get to that. So seeing as we're rapidly approaching the end of October, I assume, you know, I don't know if we can commit to like a very hard and fast timeline, but I'm eager to get the metrics information to the community that shows a cooperation between the board and the administration on what it is that determines tier mobility and movement and considerations. And I'm eager to sort of at least foreshadow sort of where we are in the timeline on sort of when a recommendation might come before the board, and you know, give us enough time to make that determination about second semester as early as, quite frankly, as early as possible. But I just want to open that up for any kind of discussion or conversation.
Well, I'm assuming the recommendation hasn't changed, and it, I mean, is not necessarily going to in the next few weeks. I would like to see more of what happened today. This is giving clarity for me. I mean, I'm happy to entertain other discussions about, you know, hey, I think we should do this or do that. Period. I'm not stuck on it has to be a certain way. But I do want to, you know, I just cannot stress enough how excited I am about today and about what that looked like, and how I feel empowered today to say, okay, I've got this data a certain way. It's everything that we've requested, and I understand where you are coming from, where we're coming from. So, but I don't know about, with today being the first day we're doing that, I don't know. Do you see what I'm saying, Francis? Like, how to commit to okay, well, this is what that's going to look like tomorrow or the day after, if that makes sense.
I don't know if I'm following you. I'm not.
I'm saying, what more do we commit to today other than this is the metric system that we're following? This is the data that we want. We're going to publish things weekly. do you see what I'm saying? I'm saying
Well, I
like,
understand that, but I think that, I don't know if you guys are saying the same thing. So I just want to make sure that.
I'm
Are
just
you-
saying kind of when are we comfortable reconvening on, if that information is brought to us? I mean, and I'm really asking, everyone else for discussion purposes. I mean, do you want to see all of November before you want to consider a recommendation around that? Are you willing to look at this at the November board meeting? And, I know I'm pushing aggressively on timeline here, but I just feel like it's an important thing. I don't know if you had something you wanted to add. I interrupted
Not on
you.
this particular, but I'll let you finish that out.
That's
So, I mean, I think what, based on tonight, and I think how things have been presented, I would like to kind of pull back from us saying, this is the vote to, to return to school. It's, if we are thinking about January 21st right now, right? Based on what we're seeing right now, we are making plans to return. And that, if the metrics stay as they are, but I think even if we voted tomorrow to say we absolutely are going to return to building January 21st, and then the numbers start going haywire,
Sure.
right? Then that is no longer a
Sure.
valid,
fair.
thing, right? So I think working backwards from our assumption now is that we're returning to building January 21st, and we need to continue to see that backup data that says we are moving in the right direction, or being consistent in that direction that that makes that comfortable for all of us.
That's what I was going to recommend.
Okay.
Okay.
Is that we use that, since that is the date that you've approved, we use that date. We bring the metrics each time and we look at the metrics. If the metrics stay within the margins that we agreed tonight were reasonable, we can talk about the metrics and what tier that would suggest based on the aggregate of all of that data. In the meantime, in November, I would recommend that we make a decision about MOCAP and starting a registration, and so that we get an idea of how many families, so that we know what we're doing with staffing. If it's possible in November, I probably will also try to have the staff survey data so we can take a look at that to see if we need to adjust plans, and if we do, we can bring the adjusted plans in December. In December, you do a thorough review of the plans, and we have, for sure, a public-facing document that explain the tiers and perhaps some video tours of what that might look like, because I think that, making folks as comfortable as possible about this is what it will look like when you ride the bus, this is what it will look like. I'd like to have those kinds of media pieces ready also in December, so folks get a sense of what that means. And if we can stay on that timeline, and if the data looks as it looks today, I think everybody in this room will be very comfortable with the return plan. So that's what I would recommend to you, if that makes sense to you.
Okay.
Yes.
absolutely.
I appreciate that.
And then I guess my point was more about, and I promise we'll get to executive session, and you nailed it about the communication piece. And so I also want to make sure that I'm clear, because the board members have been receiving a lot of communication, and I realize some of us might not be receiving as much as some others. But I just need the board to have a conversation about how are we responding to this, and that deserves a response. So, and I feel a little uncomfortable because some of these have been in my inbox for a week now, and there's not been a response. So can we have a conversation, if it doesn't need to be right now, if we need to have it offline, but like who's disseminating that information, and then making sure that we're all on the same page and what that message is, because we know that, like, for example, I know Francis and I haven't been included in some communication, and so, but we want to make sure that we're aware of those things are happening as well. Does that make sense?
Yes.
Absolutely.
And so far, I don't think has anybody come to the full board, has anybody received a reply message from anybody here on the board or within the districts?
I think anybody who has emailed return school reentry.
They've
thank
received
you.
it from you.
You at least acknowledge that those have come in?
Yeah.
Yeah.
Great. That's right.
No, you're fine.
So
And-
we need to wrap our brains around that and get that done here short.
I agree.
I will say I have responded to some because they've asked me specifically why I voted the way that I
Yeah.
voted on Thursday of last week. And so because it's not asking me what is the thought of the board, but me specifically,
Yeah,
I
same here,
have,
same
I
here.
have answered
Yeah.
those.
I think
Same
that's
here.
fair.
It's just that we do have some that have been to the full board and admin, and so I want to make sure that those have been acknowledged, as we acknowledged them prior to the vote as well, so.
Yeah, well, and as a volunteer, you know, also working a full-time job and parenting, I acknowledge that this has not, been the kind of response time that, you know, you would expect from a elected official who is, you know, working the job more full-time.
I
So,
acknowledge
yeah.
that, and I don't think my expectation is that burden should all be on you
Yeah.
as well, so know that you can call upon your peers to help you out.
And I think we may be more uniform. Like, I got some that were just to me, which I included everybody in my response, so that, you know, full transparency. But I would like it, I don't want anyone feeling ignored.
Yeah.
But I also, I mean, it's a lot of emails, and I try to read every single one, because they're all important, and it's just impossible to respond to them all. Plus, I don't want, I can't speak for the whole board. We speak as a unit this way, right? So, just maybe us asking for a specific way of reaching out so that those can be heard by everyone and responded to in a way that makes everyone know that they are heard and important. I don't care if you disagree or agree with me, your voice is still important.
Yeah, that's, my
So,
point is just to
yeah.
acknowledge that we've received it. And,
Yeah.
and, you know, it's going to be difficult to answer some of these, but at the same time, they deserve the acknowledgement of the ones that have been sent to the full board. If you've been contacted directly, like you, me, whatever, you know, you have every right to, of course, you know, that's what we do as elected officials, you know. I
Right.
certainly have talked to a lot of people. And then I promise, this is my last thing before we go to executive session, I want to give out special props to our task force. That's been very helpful. I also think it's important when we talk about supports, we've talked about staff, we've talked about our kiddos, we've talked about family. I want to really call out our principals. I know just myself since Thursday night how many referrals I've made from parents that have called me, honestly quite distraught. Please call Cindy, please call Angela, please call Mike, please call Kevin. I, as a parent, have had to call Kevin, and he's been very helpful. I have referred more people to our principals than I'm even comfortable with. And I think a special call out to them because they burden a lot of that. And I just really wanted to take this opportunity in front of the task force, in front of the board, and whoever might be watching, that I think we have a very special group of principals that are really going beyond the call of duty right now. And to our task force too.
Thank you for that. I know that the administrators appreciate hearing that, Maria. They've been working super hard.
They really have, and
Yes.
I'm creating more work for them by directing a lot of people to them, but, you know, that's what we do. So,
Great. A motion?
I've moved to enter executive session in accordance with section 610.021, subsections 2, 3, 9, and 13, and section 610.022 of the revised statutes of Missouri on October